Hi everyone, this is Dr. Zach Borus, on staff here at Lakes Regional Healthcare, Spirit Lake Medical Center in Spirit Lake, Iowa. Coming to you a week after I last talked to you. What a difference a week makes. So just wanted to talk a little bit about where we are with COVID-19, the coronavirus, what our local current response is, some new guidelines that are being recommended, and some new information out there. So there were 3 cases when I spoke with you last week in Iowa. There are now 22 confirmed cases. The first 16 of those were all people who had known sources of travel exposure. So many had been on a cruise in the Nile, some had traveled from Europe. Now we are officially seeing what we call community spread in Iowa, where people are giving it to their neighbors, or where there's no known high-risk exposure associated with these cases. I think that in the coming days and weeks, as I'm sure you're aware, those numbers are going to go higher. As I'm sure you're also aware, Governor Reynolds has taken some large and I'd say laudable steps as of last night to close schools for 4 weeks, as well as to try to limit gatherings of more than 50 people, actually 250 a couple days ago. Now the CDC is recommending no more than 50. And all of this is being done, it's a little bit confusing, but all of this is being done to slow the spread. So we are trying to encourage everyone to take measures to socially distance themselves from people who are not in their immediate family, and stay home as much as possible. This is uncomfortable, it's a little scary, but doing so will help try to avoid some of the things that have been seen in Italy, where their healthcare system is just being massively overwhelmed and people are becoming very, very ill. We've learned more in the last week about COVID-19 itself. The vast majority of people who get it will just have minor illness. That said, a significant portion could get significantly ill. It varies by age of the patient and by other comorbid illnesses, but amongst the elderly, there is estimated to be about a 15 to 20% death rate from this, which is sort of staggering. And amongst those who are younger, even if they're surviving, there are significant health issues. Thankfully, again, it is not affecting kids as much. However, they are potential sources for exposing older people, which is part of why we're recommending that schools are closed, and why I'm pleased that Governor Reynolds has done so and taken leadership here. I think there's going to be more measures coming in future days, perhaps nationally. Time will tell. But the more that you can stay home, the more that you can cook with your family, the more that you can try to socially distance yourself by not going out, not going to parties, not going to bars, the better. That said, that has major impacts on our local economy, and we recognize that. And for those of you who are business owners, this is going to be a tough time. So still, try to support your local community. Try to order takeout from local establishments. But it's important that we all come together and recognize that we're doing this so that it's uncomfortable for a bit, but not devastating in the long run. So, in terms of where we are at the hospital, we are still recommending that unless you are severely ill, you stay home if you have respiratory symptoms. So if you are coughing, if you have a fever, we want you to call before you come. So you can call Lakes Family Practice at 712-336-3750, or Spirit Lake Medical Center at 336-1240. And you'll be, if you are having concerns for respiratory symptoms, you will be transferred to a nurse who will be able to ask and go through the dialogue as to whether or not you need to come in, and whether or not, if you do, whether you need to be tested. We're doing testing right now around the back of the ER. However, we need you to call beforehand. Testing is still unfortunately very limited. So not everyone who meets the potential criteria or thinks that they're sick and could have this is necessarily going to get tested yet. We are hoping for expansion soon and quickly of access. But again, if you're just mildly ill, isolate yourself at home for 2 weeks. Don't go out, don't go to church, stay home. And if you're getting short of breath, if you're having chest pain, if you're not able to eat or drink, call the hospital and get seen, but call first. At the hospital, as of tomorrow, we are going to be limiting access. We've already put into place visitor restrictions, so each patient is only allowed one visitor, and that ideally is, their spouse or a parent. It's going to be a little more restricted in the coming days as well. Entrances are closing, so the only entrances that will be available as of tomorrow will be the ER entrance, the east entrance at the new wing on the east side, and the door by Lake's Family Practice. We are hoping to have staffing there so that we can screen people and put masks on them. But again, if you are coughing, please ask someone for a mask. You do not want to walk through the entire complex and expose people. So please protect the other people who are around you. Lakes has decided to go ahead and cancel a number of elective services. So as of right now, mammograms, Planet Heart screenings, DEXA scans, pediatric speech therapy, and immunizations are all on hold. So the immunization clinic through public health is going to be canceled while school is open, to free up those nurses to be able to go and do home visits to check on babies who may or may not need to be seen here in the clinics. More to come on that. And right now we are going ahead with surgeries, but that may change in the coming days as well. If you are in a high-risk group, so if you're over 65, we may recommend that you cancel an upcoming surgery. If you have any medical illnesses besides what you're having the surgery on, if it's an elective case, then we may ask you to cancel. And at some point we may stop doing elective procedures altogether. We are not there yet. We're trying to plan for what's going on right now and plan for the future, so that we are ready and equipped to deal with this if and when it does have local spread here in Dickinson County. So again, I know this is a scary time. This is sort of unprecedented. We haven't seen something like this for 100 years. So there's going to be some mistakes that are made. There's going to be some uncomfortable feelings around a lot of this. I know there's talk about, oh gosh, is this too early to close schools? Is this too early to have people stay home? From a public health perspective, I think the sooner the better, and we are pleased with the state's response. Again, if you want more information about whether you should be canceling things or otherwise, you can go to the Iowa Department of Public Health website or the CDC website. Those are great resources. We will continue to be as open and honest with you as we go through this process as we can, letting you know what our current plans are. But as of today, this is where we are. So stay home, wash your hands a lot. If you're sick, let someone know, but don't just rush into the clinic or the hospital. And do what you can to support your neighbors, support your family, support your friends. We will get through this together. So thanks for your time. I'll see you soon.